Actually, my PhD is in public health, and I've taught at the College of Surgeons and Physicians, and a lot of public health schools in Ghana. Biomedical ethics. I think in that kind of situation, Dr. Okoboy has covered organizational, infrastructural, administrative, and human resource, everything. He's really covered, and Dr. Anaba also brought in his piece, experience, and policy issues. So there's actually very little to talk about by us. However, I believe that there are a lot of issues that have not also been touched upon. Many of the hospitals want to reduce the death rate statistics they maintain. So some of the referral they make, it's not because they don't have bed in the emergency ward. It's not because the triage is not being done. I was once an auditing person for an emergency response, assessing the readiness of our hospitals. I don't want to mention the name of the big hospital where I was one of the auditors. I was quite disappointed with the doctors' responses and the nurses' responses, to the point where there was a surge for a moment just to create a situation to assess how they will react. It was very bad. The triaging was below, it was suboptimal. So in a case of emergency vehicle taking an injured person, Professor Zakaria, I'm sure when ambulance he was running, he was running the emergency program, and during his government's stay, everything was going quite well. But I don't know what is happening now. Whether there was proper coordination between the crew on the emergency and the hospital where they took the person. If there is no coordination, as our two eminent doctors have told us, then of course the triage will not work, because if you don't coordinate properly, the emergency ward will not be ready. And sometimes they treat the emergency ward as if it's the OPD. And then sometimes it's really not a good thing. So the infrastructure is also part of it, and the human resource and the specialists that will attend to it. I don't know what kind of message the team in the vehicle relayed to the hospital where they were taking the person.
You mentioned Professor Zakaria. He was head of ambulance service.
Yes.
What do you know in the past was the communication channel between the ambulance service and the hospitals? And are you suggesting that may not still be working the way it used to work?
Well, we shouldn't blame everything on the doctors. If the team, the EMS team, is not properly educated to even assess the situation, to give the report to the doctors that will attend to it, definitely there's a broken communication line right there. You know, so sometimes it's the fault of the EMS team. How do we train them? I know how they were recruited, many of them by Dr. Baumier's team when they were being called to service. I know that.
I don't know what you mean.
Let us not get there.
No. I mean,
let us not get there.
No, we'll not get there. But because you mentioned the name, I wanted to be sure. If this is an allegation that
when they were being called, about 600 of them or 300 of them at one time at the Flagstaff House or Jubilee House at that time, that were being honored for being recruited into the EMS team and all of that. I know I have people that were actually there, and I was talking with them while they were there.
This way, Dr. Okoboy, you know about this, as a matter of fact, because it sounds like an allegation.
I think we're having a nice discussion. Maybe you don't digress a little, so bring Doc back.
Yeah, that's what I was, because I don't know about that.
But the point I was trying to make is that how were they selected?
Are you saying they are not professional?
Initially, no. They had to go for training.
So they were brought in for political reasons?
No. I mean, they had to recruit the youth. They had to give job to the youth. So that was one way.
What kind of youth?
Well,
but speaking for the service, yes. Even no matter where you are brought from, before they pass you out, you receive the training.
They receive training.
Okay. But so I'm saying this because I'm thinking it's not fair that you mentioned that they were brought through Dr. Baumia, because if they go through professional training,
the selection was not professionally done.
Politicians always have these things where they have
And that is where the problem
there's
is.
a list they call it.
That is where the problem is.
So you're saying that recruitment abolition was wrong?
Meritocracy. The selection
but
was done.
I've said that without mentioning names.
Yes, that's what I think.
Omar Rufai, you are the best journalist for today.
But I was a witness. I was a real witness to what was happening because I had people that had been selected.
When you make a statement on a show like this,
yes,
and I don't have evidence to support your claim, and it is you who know this and I don't, and I can't prove it.
I know.
I would not like for you to say something like this unless there's evidence to show. And to the extent that
if I knew that this was going to be an evidence-based kind of thing you wanted, I would have brought the evidence.
Yeah,
or
I would
you can follow up.
No. So I would appreciate
verify
that you have
so
the
you can discredit or credit.
No, but you avoid names.
Okay.
So that I don't land in trouble with you. Thank you.
Okay.
Yes.
I'm available to be arrested if you want to.
On this, so continue.
All right. So the selection process, the initial selection process of the EMS crew was not based upon meritocracy. They did not even.
And is this something happening all the time in the past, or is just a one-off thing?
I'm talking about the initial selection process.
I'm saying that.
And they are now the leaders because they were the first crew. So they are now probably the supervisors and so on and so forth.
Which first crew? Of the ambulance service?
The ambulance service. I'm talking
but
about the
ambulance
people.
for many years. I don't understand. I'm looking at timelines.
Oh,
so
no. If you can bring Professor Zakaria and he will give you a bit more details.
Are you referring to the new ambulances that were brought in the Akufo-Addo one?
Yes, you needed to fill them with people.
So from that period, that's what you are talking about.
Exactly.
So I want to be sure so that timelines work well. Because when you say the first time, I think ambulance has been in Ghana for decades. So that's what
in an organized way. That was the only time we have had a large number of ambulances, and where large numbers of people were recruited.
Very well. I understand you now.
Okay.
Good.
Okay.
So proceed.
So the selection wasn't very good, and so when you start on a very poor level. Some of the people that were recruited probably should never have been there. Okay. So if they are communicating with a hospital, in order for them to prepare the ground, and even before you get the patient physically in front of you, you have to have an idea of how you are going to do your triaging, especially if you've been told of the kind of injury. So for me, I think that the issues that we're talking about, I've done a few papers on assessing hospitals' readiness in emergency responses, and it's very, very poor. In 2012, Ghana Medical Journal, it was published, and I continue to do these kinds of things. And so I believe that Dr. Anaba, what he's saying is that yes, the policy is there, but our doctors are not following the policies. And the new doctors need a lot of training. As Dr. Okoboy was also mentioning, part of the reasons why the hospitals don't want to receive people unless you put money down for whatever the emergency, going back to the policy, is that the National Health Insurance Scheme is a little bit, and you were there, Dr. Okoboy, it's not inclusive in terms of the coverage of the emergencies and diseases that are supposed to be covered. Every time I see on TV people soliciting money for leukemia or whatever operation overseas, it breaks my heart. These are things that are supposed to be covered by the National Health Insurance Scheme. UK has a National Health Insurance program. They never let their people go out and solicit for money from private people in order for them to take care of leukemia or whatever the disease may be. And so I think that because of corruption within the medical system in Ghana, that is an issue I'm sure our good doctors don't want to bring out. But in 2012, the WHO did a study on for every dollar spent on healthcare in Ghana, only about 10 to 12 cents is actually spent on health. The rest goes to administration and the rest are stolen. So we did an assessment of the hospital readiness of emergency care, the supplies there. And in one hospital, in the emergency ward, I actually went through to see the medicines that they have packed in the cabinet, whether they were actually the vials of the medicine Procodam and all of that, those painkillers, they were all there. They were empty. They were just the packages that were there.
So someone diverted it?
Somebody stole it. Okay. Use the word. Somebody stole it.
So thievery in the health sector
is big. So it undermines a lot of the equipment, because Dr. Koboy mentioned that some of the equipment you find, how many of our doctors actually have access to working X-ray machines? And how many of our new doctors actually can interpret X-ray report or ECG report? Many of them don't have the capacity, the new ones. So we have a systemic problem with our healthcare system.
So for you, the professional training...
I'll with my senior brother.
You don't agree that
doctors don't know how to interpret X-ray and those things.
Some of them.
It is a structural problem. There's a full strategic failure in the health sector and lackadaisical behavior of we politicians, governments upon governments, to attend to the health sector. Why they're crying for money that we should get and borrow money and give to cocoa farmers? When we're not crying for us to borrow money and give to the health sector to provide the needed infrastructure, the required numbers for us to attend to ourselves. He was just telling us, every population of 1,000 needs 5 ICU beds. Do we have it?
No.
Who is fighting for it?
Nobody.
You want to increase the health budget to even meet the ECOWAS convention, you won't get. That is where the problem is. Okay. I'm not saying that what I read today blaming doctors is because the doctors are the cause. It's because there's an administrative failure.
Yes.
And that includes financing.
Okay.
If Rich Hospital has monitors at emergency to take care of patients, but don't have monitors in the ICU and the ward to take care of patients who are supposed to be transferred within 24 hours, then management has failed.
Yeah. So Dr. Norman,
that's the problem.
So Dr. Norman, you may have a challenge with professional training and all of that, but I'm not sure a doctor would have a challenge as basic as not being able to read an X-ray when they put it in that glass thing with the light.
They will not.
Maybe they will not have the glass thing that you used to read.
Some of the new doctors, my gentlemen, will not admit it.
We have radiologists, simple X-rays they can read, but there are complex X-rays that you need a specialist to read. There are two different types of X-rays.
Thank you.
With all due respect to Prof. When
I'm not a professor. I'm a doctor. When you
draw the curve in every profession, you can have a chartered accountant who is getting the basics wrong with accounting. But in terms of the majority, the curve, majority know how to handle basic X-rays. Okay. So, I mean, you can find a doctor like that, but it will be
it's rare. Yes. Okay. So conclude for me.
All right. So for me, I think there has to be
retraining.
There has to be
retooling versus retraining. Which one should prioritize?
Both of them should go hand in hand. There should be synergy between the retooling and retrain. Because if you bring new equipment, you have to train the people how to use it, right? So for me, I think that this government is trying its very best. Without this government's effort in the first term of Mohammed's presidency, COVID would have taken care of a number of people. They would have been dead.
Because of what not agree, even though his former boss
he would not agree, because it was because of my advocacy that he was brought to Minister of Health.
Oh, really?
Yes.
So has he paid you?
There was no. He's never even thanked me.
Oh, good boy.
I will say it in front of him, in front of everyone. He has never thanked me. Because he had an accountant as a minister.
Yes.
Then we had a beautician as a deputy. Then we had a lawyer as a deputy. It was on one of the programs that I said that the government is out to lunge, and I whistle like that, and because it was horrible. Luckily, Kwame Mpianim agreed with me that you cannot have a ministry where you don't you don't have any doctor in that. Okay. That was why he was brought there.
So you're saying that currently too we should have a doctor as a the deputies.
The deputy we have.
So
now the setup is fine.
It's fine.
And Honorable Akando is doing a fantastic job.
Okay.